Welcome, everyone. We'll have a fascinating guest today. His name is Dr. or Professor Gian Carlo Di Renzo. He's currently professor and chair at the University of Perugia and director of the Reproductive and Perinatal Medicine Center. And we're going to be talking about the placenta and some fascinating discoveries. Before we get started, if you want to support our podcast, make sure to share and subscribe. We truly appreciate it. So let's not waste any more time, and welcome to the show, Professor Di Renzo. Welcome, Professor.
Hello to everybody. Very happy to be here with you.
Thank you very much. And you're over in Italy? What part of Italy are you in?
Oh, Perugia is a small city in the center of Italy, not far from Rome, not far from Florence, but as one of the oldest universities in the world, I think, because it's been founded by the Vatican in 1308. And this year we celebrate 700 years of medical school.
Wow, 700 years. So you're the perfect person to talk with about the placenta.
Want a history from the ancient times? I am probably one person, but I don't think that everybody is interested in history today. They want to know what is going on today.
Yeah, that's right. And today we have a very interesting discussion about the placenta and sex differences. Tell us a little bit about this, how you discovered this and what was going on.
Yeah, it was some paper that produced almost 20 years ago, in which I started realizing that, we are usually differentiating very well. And nowadays, everybody is looking from the beginning of pregnancy, even after the test is positive, they want to know if it's a boy or a girl, okay? And you know that after that, there is a very big subspecialty, let's say, of gender medicine which is based on the sex of the human being, because it makes a difference how we face our environment, our lifestyle, how we accept nutrients, what is the organism reaction to many things, stress and so on. You're much more, of course, aware of this. But nobody has paid too much attention to this organ, which I remind to all of you, that is the organ which is the barrier or the border from the mother to the fetus, and is helpful because it transmits a lot of good things from the mother. Is also a barrier in which it avoid the wrong things go from the mother to the fetus, and send a signal from the fetus to the mother when the fetus needs something. Okay, and everybody has thought that is a natural organ. Okay, the boy is a boy, the girl is a girl inside, placenta is neutral. It's not true. It's not true at all. Placenta has the same sex as the boy or the girl and behave in different way. In principle, have you ever asked yourself why the boy in all ethnicity all over the world are born a little bit weighter than the girls, 300 grams of difference? Why there is need of such a difference? Have you ever asked yourself why the boy should be bigger? Do you think that they became bigger later on? No, it's not a true reason. It is because I should say that the boy receive much more nutrients because their placenta are less barriers. And at the end of the day, the placenta for the female is very protective because female are the most important to maintain our species. The boys doesn't make too much sense that if they are a little bit wrong, a little bit bigger, a little bit smaller, because it's not. It's enough a boy to make and maintain the species, but we need a lot of females. So placenta is very selective to the female inside, the fetus female. It's not so much selective for the boys. And this is demonstrated by several things. For instance, passages of microorganisms. If you think, for instance, the passage of virus, we don't have data on SARS-CoV-2, but CMV, cytomegalovirus, or Zika virus, it crosses the placenta much easier when there is a boy than a girl. Girls are much more selective. So if you see a teratogenic effect from the virus, is much more frequent in boys than in girls. And this is one reason. So I would say that the environment for the boys is much more, let's say, minimalistic approach, okay? And for the girls, much more selective. That is the first observation. And I think this is rather interesting for the next observation.
Absolutely. So the boys are much more vulnerable than to what do you call it, endocrine disruptors and things of that nature.
Yeah. And for instance, this is something that affects much more the placental boys than girls.
Oh, wow.
The endocrine disruptors that we may have in our environment or in our nutrients. One of the things is that if you see, for instance, when there is, the boys are usually, as I said, waiting a little more than the girls at birth. If we look at the same gestational age at birth, boys are 300 grams more on average, okay? But this doesn't mean they are stronger. Not at all. They are much weaker. In fact, if we look in earlier gestational age, let's say we take a boy or a girl which is born at 7 months, who is the one that's a much more chance to survive without anything, no intervention of doctors? Female for sure, not the boys at all. Because female mature and they are ready 2 weeks earlier than boy, for instance, to face extrauterine life. And it's something that every neonatologist knows, that if they have to care for a preterm boy, it's much more difficult than to care for a preterm girl. Results are quite different, much better for girls than boys. Okay?
That's fascinating, fascinating. So they're much more vulnerable than. So what was the other discoveries you were leading into? You said there was other discoveries as well?
For instance, one of the reasons why the boys are much more prone, are a risk factor for two major things. One, the shortening of pregnancy. So if the mother has a boy, okay, she has much more chance to deliver early than a girl. Much more preterm births in boys and in girls. And another is that the boy, due to the placenta, which is bigger, and has different enzymatic activities, predispose more the mother for gestational diabetes. So the mother of a boy is much more frequently getting diabetes than the mother of a girl. And this is paid also later, after pregnancy. So if the mother, if you do a statistics, and you take a mother of boys, which have only one boy, a mother which had only one girl, compare for the BMI, the lifestyle, and so on, the mother of a boy will have much more chances to develop diabetes after pregnancy than the girls.
Wow.
Okay? And this is because, of course, boys, due to the small chromosome Y that is left from the father, this chromosome is changing the hormonal status and also the hormonal status of the placenta, producing testosterone, dihydrotestosterone, and so on, which are hormones which attract a lot of nutrients with too little barrier, okay? Because the let's say, target of the male is to grow, to be bigger, of course, and this will be also after the birth. We know that the boys are bigger than the girls in general, okay? But they are not so healthy, I would say, compared to the girl, which are facing much better life, extrauterine life, okay, for this reason. Because to be big in muscles, and strong, to be strong, it doesn't mean that you are strong also against microorganisms and so on. Microbiota is different, especially because of this. And let's say, the legacy of the placenta for the adulthood is to get much more chance for the boys to be affected by major disorders and to live shorter than female. We know that in any generation, and especially nowadays in any country in the world, even though there are differences between female and male, the female live longer than male. okay? Few years, but longer, okay?
Mhm.
Despite their pregnancy, they have maybe major disorders, and apparently the male are bigger. And this is something that we pay from the beginning of our life.
Interesting. Interesting. I know there's some psychopathologies that are much more prevalent in boys, like antisocial personality disorder,
Yeah.
autism as well. Do you see anything here as far back as during the times in the placenta that might have an influence on these?
But the connection between the function of placenta and especially the growth of the baby and some neurodevelopmental disorders later on are now well established through a mechanism that we call epigenetics. Okay? So, what is happening during intrauterine life in a particular time in which our phenotype is plasmating? We have fixed genes, fixed DNA, but this can be plasmated by the environment. And environment is everything around us, from the pollution, but the nutrients, the drugs we take, and so on. Now, you should know that placenta is having transporters. Okay, there are families of transporters, and the gene expression of these family transporters is mediated by the endocrine disruptors, by the drugs that we give to the mother, by the nutrients, and so on. And there are differences between male and female. Okay, after a while, the transporter may not work properly, and they may affect the fetus, impairing the project of growth that is given by DNA. An example that I want to do to everybody to understand, because maybe there are some students, they found difficult this kind of concept, is have you ever thought that the difference between the queen bee and the small bee, which are going around the fields to prepare for honey, okay? Do you ever think that they have the same genetic pattern, but one is 10 times bigger than the other? And the bee which going around the field are completely sterile, and the only one which is fertile is the queen bee? What is the difference if they have the same genes? The bee queen is grown during fetal life in the so-called papareale, the real honey, a special nutrient that influence completely the action of the genes to promote fertility and to promote growth. So only
Really?
one selected is put in this special environment, which in this case is nutrient. All the other bee will be small, and only one is big, but they have the same genes. And this is epigenetics. So the same can happen in any fetus, and we are much more complicated, of course, than a bee. We have a brain. Brain is forming, and if we affect some connection in the brain, we may favor, as you know, that you are expert in the area, we may favor the development of disease like autism, like the hyperactive disorder and so on, which have a basis in the malfunction of some of our genes, which are connecting different parts of our brain. Is it
Wow.
more clear this? So there is
Oh,
a
yes.
influence of intrauterine life. And the fact is that we are witnesses an increase of this kind of disorder in the last 30, 40 years, which is not related to any changes in our genes. So what is changing? Are we more able to make the diagnosis? Yes, can be, but it's not enough to explain the increase of these disorders everywhere. So there is something else. Our environment, our nutrition through the placental are affecting also this kind of development of these disorders. And is intrauterine plasticity, which is not amenable then to change too much after we are 2 years old. And unfortunately, this we will pay later as children or as adults.
Yeah, there's so many different things that could be influencing it, right? There's medications, there's substance use. The more you talked about it, the more I thought how important it is for the mother when she finds out that she's pregnant to understand what she's taking and how that could impact her baby. I mean, coffee, marijuana, which is another thing that's been popular, medications, anything like that is extremely important.
Is outstandingly important. Is a window of opportunity, pregnancy, to correct many things, but is also a window of risk. Because just to mention the fact that, everybody now is promoting the supplementation with the folic acid, folate before pregnancy. Why? Because folic acid is intervening in the construction of fetus, in the neural tube construction. And if something is wrong because the level of folate, which in our nutrition are low usually, okay, are remaining low, we have a fetus with the disorders like spina bifida, myelomeningocele. So this kind of alteration, which are very big problems, for not only the baby itself, but also for the family and the society, because it's a major handicap. And you just need one single vitamin to change everything. You can imagine how important it is in a crucial time, which is only the first few weeks of gestational age, to change everything from something that can be completely wrong to something that is completely healthy. So what you are saying is extremely important. Everybody should pay a lot of attention to the period. For instance, smoking is affecting not only the growth of the baby in weight, but it's taking out part of our brain. You cannot pretend that if you smoke in pregnancy to get a baby which is the same as a baby of a mother who didn't smoke. And the same if you drink alcohol. You should know that alcohol has no enzymatic activity which make a barrier in the placenta. Placenta is devoid of any capability. So the fetus became completely drunk in a minute when the mother drank alcohol. Then the mother has the capability to metabolize. You became vasodilated because there is a change in an aldehyde. But the fetus not. And the alcohol goes directly in the brain and may affect the brain, particularly if you drink alcohol in the first month of pregnancy. So these are examples, and this is a clear example that you may change the fate of your kid, male or female it is, how is the lifestyle and the environment where the mother is living and is living pregnancy particularly.
Amazing stuff. I guess one of the questions that I wanted to ask too, and I'm not the expert here at perinatal, so you have to excuse me if I get it wrong, but I think it was between 12 to 18 weeks is where the testosterone levels are really high, especially for male fetuses. Is that another very crucial time as well in regards to any kind of endocrine disruptors coming into play?
Yeah, especially in the time in which the, let's say, the reproductive organ are in not only in formation, but also in start functioning. We have to remember that all the oocytes that a girl can have, and they will be useful after the puberty, okay, not before, they stay like in freezer for a few years, they are made during fetal life, not a bit after. So the 600 or more or less 1,000 oocytes that a girl can use in reproductive age are made during fetal life, and they start working 12 years later. But in this period, if you have endocrine disruptors, your oocyte will be or less, or malfunctioning, or having something wrong, okay? So this is very important to understand that many of the diseases that we may face, sterility or so on later on, we call sterility, but there are many areas, can recognize, some effect of something wrong during the pregnancy period. We forget a lot of examples that we have very clear from the past. In the United States, in the 50s and 60s, one of the most, let's say, used drug for prevention of abortion was diethylstilbestrol. Okay? Diethylstilbestrol was used by every mother when there was, the risk of even some pain or little bleeding, to avoid abortion. Then, what happened? Diethylstilbestrol is not an innocent drug. Fortunately, few years later, 20 years later, one gynecologist found that many teenagers have an extraordinary high number of anomalies of the genital tract, even adenocarcinoma of the vagina. And then he collected, it was Professor Herbst from Chicago, so from the United States, and he connected the use from the mother with silbestrol, which is an endocrine disruptor, with the genital activity after puberty. Not
Wow.
just the baby was born perfectly normal, looks normal female, but at 12, 15, 16 years old, start to have a lot of problems on menstruation, on reproductive activities, and so on. And this is an example, quite clear.
Wow. That's amazing.
Yeah.
They're finding a lot of connections. And I had two questions and I lost them, but I'll get them back in a minute. One of the other questions was,
Gynecologists in the world also to think about this during pregnancy, because as I told you, we have established very recently, we have done a research on 4 million singleton pregnancy. We published PLOS ONE a couple of years ago, looking to risk factor, for instance, of prematurity. And one of the risk factors of prematurity is to have a boy instead of a girl in the womb. Just to tell you, and are not a small number, because we look to 4 million pregnancy, taking even California as one of a country with the best database that we used for this kind of investigation. And if you have this kind of result, you cannot forget it. You have to be careful when you have a mother which is bearing a boy fetus, and be careful in following a little bit what are the major risks she can have, not only in pregnancy but afterwards.
I remembered my question, because this is a big issue. I know they're checking a lot here, but you mentioned a minute ago the medication, or the medication that they were given for abortion. But how about medications for moms who have depression or bipolar or things of that nature? That makes it complicated again. Have you seen any studies there at all?
No, there are many studies, of course, that are, the problem is with this study that is very difficult, because usually I should say that unless are needed, because psychiatrists demand that drug should be taken during pregnancy, the most of the mother stop this kind of drugs during pregnancy, at least after the first 2 months. So we should say that at least in our European environment, is not easy to find a population that is easy to evaluate versus control, to understand what a specific drug can do, because there are a lot of attention about this kind of drugs and what they can do. One other thing, however, that is, better than me, that many of these drugs induce a lot of enzymatic activity by themselves. So they are, inducer of enzymatic activity. And this happens in the placenta. Placenta is laboratory of enzymes, which are useful. So some of these enzymes may protect the fetus, by the way, and therefore the derangement you may find, except for drug of addiction, like you take cocaine or heroin, or this kind of very heavy drugs, the effect on the newborn are very mild, okay, very mild. And there are not many studies to look at a long follow-up. But it's quite clear that there are differences in neurodevelopment if you use this drug for all pregnancy, then not to use.
I read a study a few months ago, and it was interesting because while they're going to give birth, they give pain medication, the injections. And I can't remember the name of the drug now, but they were defining some studies that they had a correlation between moms who used this pain medication during the time of giving birth and afterwards, with the child having more aggression. So that's still impacting the placenta even at that late stage? The pain medication before they actually give birth, an hour or two before?
It depends. There are two big variables. First, we have to consider how long is the labor and delivery in order to leave the fetus under, the effect of this drug. Because if the labor is short, the baby is out, you close the clamp, the cord, and there is no more passage. First. Secondly is the fetus is under a lot of endorphins in a very stressful situation, in a normal labor, vaginal labor. I don't say cesarean section. This is quite different. Let's say normal labor. Why we don't recall anything about normal labor? Nobody was recall. I get through this tunnel in my mommy before getting out. Nobody. Why? Because we are completely addicted of endorphins. You know, our nature has put us under a big protection of endorphins in our body. And we don't feel pain and we don't remember anything because you are full of endorphins like this. So the effect of this drug is quite different. And I don't think that for short time, they give really very remarkable the difference later on. It may be that if the labor is long, there are stressful, increase, for instance, of adrenaline, like in the mother, cortisol, especially, which alter the endorphin of the fetus. The fetus may have less endorphins and be more stressed, especially if there is also metabolic acidosis and so on. In this case, you may have effect afterwards. But it's a complicated matter because, you know, labor and delivery is so complicated in the many hormones which are playing roles, starting from prolactin, endorphin, cortisol. Everything is at, n power in a body that we have. And then decrease after slowly, and then we are peacefully in the world. But the entrance in the world is something that nature has protected. Okay.
That's a great example. I guess my last question is, anything new now on the horizon? Any work your folks are doing now that you're studying?
Yeah, we are looking to some, let's say, nowadays one of the effects that alter very much our body homeostasis is the so-called oxidative stress. Okay. Everything entering our body should be cleaned by scavengers because the production of products which are cleaned by the kidney or by the lungs produce special molecules of oxygen which are toxic for us. It's called oxidative stress. The fetus has the unique opportunity to send these molecules to the mother because he has no way to release these molecules in his body because, of course, circulation is within the mother. So it's interesting to look at the oxidative stress and difference between male and female placenta. We have already shown that male placenta face much less, are less scavenger than the female placenta. Again, demonstration that if there is something that the fetus produce more, the mother is capable to do better if it's a female and not a male. And this leave the fact that the fetus with a more oxidative stress may encounter more problems and more, let's say, noxious eats compared to female. I don't know if this is something that is important afterwards, but it's something that we are demonstrating nowadays quite clearly. So it's another thing to study for the future, because if we can demonstrate this, we have drugs, as you know, vitamins that can ameliorate and the antioxidant system of our body, like vitamin C, vitamin E, antioxidant drugs, and so on and so on. So it leaves open space for some supplementation can be used.
You have a lot of work ahead of you.
Very exciting, this area.
Absolutely, very exciting. Again, folks, this is Professor Gian Carlo Di Renzo. He is currently professor and chair at the University of Perugia, also the director of the Reproductive and Perinatal Medicine Center. Also, by the way, folks, if you want to support our podcast, share and subscribe. Doctor, thank you so much for being here.
It was my pleasure. I hope you enjoy. Okay.
Fascinating discussion. Thank you so much. And great work. I mean, we really appreciate the work that you're doing out there. Thank you so much.
Okay.